All right. Welcome everyone to the August Healthy Eating Active Living Work Group monthly meeting. So to give a brief overview of our agenda, today we're going to do a lot of discussion around the HEAL work plan. As a reminder, we create a new work plan every 3 years to go hand in hand with the community health assessment. The most recent community health assessment was completed in 2022. So we're now working off the results of that health assessment to create or update our work plans for the HEAL group. Then we'll move into any subcommittee updates, and then lastly, community announcements. So again, thank you all for joining us. I know this time of the year can be hard to get on meetings with vacations before school starts, but I appreciate it. So if everyone could just introduce yourselves, please either in the chat or feel free to raise your hand or just speak up. Your name, your organization, and as an icebreaker today, do you or have you already seen Barbie or Oppenheimer? And I think I'm pronouncing that right. I maybe obviously outed myself that my name's Kim Stinchcomb. I'm with the Prince George's County Health Department, and I have already seen Barbie. I have no plans to see the other. Not that it's not great, but I would love to hear about everyone else.
Hi, I'm Margaret Fowler from Totally Linking Care, Maryland, and I've seen neither of those movies, and I probably will not go see either of the movies.
Thanks, Margaret. Anyone else open to sharing?
Yes, good afternoon. I'll break the ice, Kim. So good to see you. Good afternoon, everyone. Sade, I'm with the Prince George's County Health Department, Adolescent Clubhouse, and I am the recruiter for the program. I haven't seen neither, and I don't plan to see either. I may go to see Barbie, but not the other movie.
Thank you, Sade. And Casey?
Casey Dyson with Food and Friends. We do medically tailored meals to Prince George's residents. I am in the Oppenheimer group. Though I had a Barbie when I was a kid, I'm more on the science side these days.
Thank you.
Hi, it's Leslie Jefferson, Giant Food. I think I'll wait for them to hit the streaming circuit.
Yeah, with all the uproar, I didn't gauge the room that we weren't movie people, but there was so much uproar around both of these coming out.
Hello, everybody. My name is Benji. I'm with the Prince George's County Health Department, and I'm going to see both this Saturday. A whole group of friends. We're gonna pick up the entire movie theater, just cause.
Excellent. All right. Well, everyone else can feel free to give any other updates in the chat. So I wanted to start today by kind of reviewing the vision for the HEAL work group. So the Healthy Eating Active Living work group envisions Prince George's County as a place where everyone has access to fresh, nutritious food and environments that promote good health, wellness, and active living. And then we're just going to dive right into the work plan. So for this discussion, I'm going to walk us through it. I know we have some of our co-chairs on, but everyone, please be welcome to speak out. This is very much in draft form. So we want to make sure that we get everybody's feedback around the goals, the objectives, and the strategies. And I would like to spend some of this time building out some of our action items within the various strategies. So please use this opportunity if you feel very strongly about the resources that are available or not available, or I will leave it at that. This is an open discussion. So just starting out with a little bit of the updates around this data. So for adult obesity in the county, 40% of Prince George's residents are considered obese, compared to 34.1% of Marylanders, and 36.1% are overweight. 6.5% of residents have been diagnosed with cardiovascular disease, and 3.6% have been told they have COPD. 31.6% have been diagnosed with high cholesterol, 35% have been diagnosed with hypertension, and almost 3% of residents have been told they've had a stroke. For diabetes, around 11% of adults were diagnosed with diabetes. This is actually a decrease from 13.8% in 2019, but still higher than the state at 9.2%. And then apologies for this display of this data going off the screen. We have for diet, we have 33.5% of adults consume fruit less than 1 time per day. And specifically in adults with diagnosed hypertension, that's 31.3% consume fruit less than 1 time per day. So we're seeing no significant difference there. 24.2% of adult residents consume less than 1 serving of vegetables per day, and that is 20.5% of adults with doctor-diagnosed hypertension. And I should add, those data were Burfess data. And then moving into our youth, YRBS, 31.5% of high school students and 30% of middle school students have described themselves as slightly or very overweight. 21.3% of high school students have obesity, and 18.6% of high school students were overweight. This data point, the 49.3% of middle school students are trying to lose weight. I don't think that's speaking specifically to any health risk, specifically as obesity is a health risk, but it is what's available in YRBS for middle school students. I think it's alarming, if nothing else. And then for diet, 21% of high school students did not eat fruit 1 or more times in the last week, and 22.1% of high school students did not eat vegetables other than green salad, potatoes, or carrots in the last week. And then for activity levels of our students, 25.5% of high school students and 30.4% of middle school students were active at least 60 minutes a day for 5 days or more. 38% of high school students and almost 48% of middle school students attended physical education class 1 or more times in the last week. And then lastly, almost 40% of middle school students participated in at least 1 sports team in the last 12 months. So I just wanted to provide these data to really give that quick overview of the status. We do have some updates from the data that were in the CHA. So most of these are, I believe these are all 2021 data points. So our goals, our defined goals for the HEAL work group are to increase access to healthy living programs and resources that address metabolic syndrome and obesity, and also to promote HEAL in county policy and zoning. Some long-term objectives specifically for this group, by 2026, reduce the overall percent of adults who are obese by 5% from 40% to 38%, reduce the percent of adults who reported a hypertension diagnosis by 5% from 35.5 to 33.7, and then reduce the percent of adults who reported high cholesterol diagnosis by 5% from 31.6 to 30%. So, and to define these change goals, I really looked at where we are as a state and where we've been in the years from about 2017. So for most of these data, we see that in 2017, we had some of our lowest rates of these risk factors. So I think it's achievable. But does anybody have any immediate reactions to these numbers? Okay. And of course, we understand that as a coalition, you know, these are our goals, but that this responsibility does not lie specifically on us, and that there are a lot of other confounding factors. So diving specifically into the Food as Medicine subcommittee and our goal of increasing access to healthy living programs and resources. So as a slightly shorter term objective, we have to increase the consumption of fruits and vegetables in residents with chronic disease. So we're going to go a little bit more in depth into some of these strategies, but wanted to introduce them first. Complete the evaluation of the Prince George's Fresh Pilot Program. Promote the outcomes of the Prince George's Fresh Pilot Program. Identify funding opportunities for food as medicine or produce prescription programs. Refine food as medicine program components based on the evaluation and stakeholder feedback. Implement education and food distribution nutritional support program utilizing an evidence-based nutrition ranking system. Expand the National Capital Parks and Planning Healthy Minds, Healthy Bodies grant, and monitor and promote policies that increase access or address barriers to active living resources. So now we're going to walk through these piece by piece. And again, please feel free to just raise your hand or jump in. So this first strategy, if anyone is not familiar with, is there anyone that's not familiar with the Prince George's Fresh Pilot Program? Okay, excellent. So I know we'll probably get into updates later, but if I see Leslie is on, if Michelle is on, or if either of you want to give a brief update of where things are. I don't see Michelle, but IPHI is running the evaluation for this program. My understanding is that they're finishing that up and have a goal of completing the evaluation in September, this September 2023. They've
Correct.
been okay, perfect. Thanks, Leslie.
So yes, if you don't know, Prince George's Fresh is a food as medicine intervention, $80 a month in store benefit for fresh and frozen fruits and vegetables, quote unquote produce. So the pilot has basically, it's in the process of ending. We're in the last trickling downs of the last shopping for this particular pilot. And the IPHI team is currently doing their evaluations. They hope to have that done September-ish timeframe. So they're gathering all the data so that we can then move forward with reporting. And the next steps are creating a white paper about the experience and about the outcomes.
Thanks, Leslie. So yes, these are kind of our next steps around that evaluation. Does anyone have any questions around this program or the evaluation process? We did just start discussing additional follow-up engagement with the participants, maybe 6 months to 1 year after they've completed, probably more like 1 year after they completed, to capture adherence or any lifestyle changes that they were able to maintain afterwards. So we'll be able to provide updates around that, but if anyone has suggestions, please feel free to reach out. Okay, moving on to strategy 2. This is where we'll be focusing on the promotion of those findings and the Food as Medicine program. We would like to present at the Prince George's Healthcare Action Coalition quarterly meeting in December. There's been discussions around holding a summit or a meeting to present those lessons learned and or apply to present findings at public health conferences. Presentation to County Council and Board of Health to build support for the FAM program. We know in terms of making policy change, we would like to enhance any opportunity to create more funding opportunities or more support in the Board of Health. And then lastly, engage with organizations to strengthen the FAM program's impact. Any questions around strategy 2? Strategy 3 is identify funding opportunities for FAM or produce prescription programs. So we have an application for the CDC REACH grant funding. Hopefully we'll hear back about that soon. We are also currently in collaboration with Georgetown University to support Maryland legislation for produce prescriptions to be covered under 1115 demonstration waivers. So the next period, I believe, is in 2026, the renewal period. So we have that time to start building support and hopefully building a statewide coalition where we can expand opportunities and funding so that these programs are more accessible and not as dependent on grants. And then lastly, we'll be exploring SNAP benefits and opportunities to use SNAP benefits for similar programs. Does anyone have any questions or feedback? And I don't want to keep putting you on the spot, but Leslie's been in those conversations as well. So if there's anything that I've missed.
No, you haven't missed anything. Very comprehensive. I will say on the SNAP benefits, Baltimore City, I did speak to them. So I don't know if you want to do your fancy filling in. Yeah, that was done with ARPA funds. And that was how Baltimore City decided to move forward and using part of their ARPA funds for SNAP benefits. It's a really interesting online SNAP program that they have. So if we want to explore different ways that we can incentivize SNAP within the county, that would be a great something that we could look into.
Thank you. Thanks for the update. And one piece that is missing from this is finding ways to meet populations that are not covered by Medicaid, but still might need additional support for access to healthy foods. And any questions around strategy 3? This is really just, this page just has a little bit of some resources around the food as medicine and produce prescription programs. And I think some of it gets into the use of 1115 funding. But these are all links and they'll be available when I send out the slides. Right, moving into strategy 4. This would be refine the food as medicine program components based on evaluation and stakeholder feedback. So this is really just taking that, all of the results of the evaluation and turning it into next steps, either implementation of our own next food as medicine program or supporting other programs who plan to do so. And any feedback on strategy 4 or thoughts on ways we can get more specific?
Kim, I was just, so what there's, just clarifying when there, so this is still something that needs to be worked on because okay. I just want to make sure.
Yes. So I feel like a lot of it will be dependent on the findings from the evaluation, and then we can get a little bit more detailed. And Anthony?
Just a quick question. I know originally there was 4. How many families are enrolled in the program at this time?
How many people were enrolled? I believe it was about 80 people that completed the program.
Roughly 80 people, yes.
And I think the last 6 were finishing up in July.
We got the final the other day.
Excellent. Okay, so this strategy 5 is a newer idea, so definitely a good opportunity for discussion here. So implement the education and food distribution nutritional support program utilizing an evidence-based nutrition ranking system. So our thought here was to have some kind of collaboration with the Food Equity Council and just our, providers throughout the county to help the people they serve identify healthy food options. We know, thanks to Leslie, that there are a lot of evidence-based nutritional ranking systems available that make this a little bit easier. I think we looked at, and Jessica, I think thanks to Jessica for bringing this idea to our attention. I know, Jessica, you mentioned like a stoplight methodology, and then Leslie has discussed one that's a little bit different. So I feel like some of our earliest discussions might just be around exploring the different options and what might be best for the community.
I was going to say, it looks like, several stores have varying programs that identify that within their stores, so it may be, and I doubt it will ever become something that'll be a standardization, but, maybe it would be, because depending on where you shop, I think it could be varying. I mean, they still should follow the same guidelines, but, how they educate their consumers or their patrons is different.
And I think our thought was to find a way to collaborate with oh my goodness, completely drawing a blank on
With
names.
food, this was more targeted towards food pantries versus
Yes.
stores. Right. Yeah, it wasn't for like,
Gotcha. Okay.
yeah, it wasn't for commercial stores or grocery stores. Right. It was for more like community food pantries. And probably more, and this probably be more for like choice pantries as well. For so consumers can have a more to provide individuals who are utilizing food pantries the ability for them to have the ability to kind of select more nutrient based food, or at least have the knowledge of what are the foods that are available to them that are more nutrient dense. So yeah, but this is ideally for food pantries, not for stores.
Thanks, Jessica. I'll make sure to clarify that in the language. And this could be something that we, obviously right now we're in the throes of implementation of the Food as Medicine Prince George's Fresh program. So I think we could give this some time and energy into defining which process we want to follow and just coordinating with Food Equity Council to see what they feel, and Department of Social Services to see what they feel is feasible.
Kim, this is taking like a one step back because, I've run a food bank before. I don't know if you would want to consider even doing a survey, because a lot of times the sad part is the food that the pantries may not have a great selection. I don't know how to say that nicely, but I mean, it's not any reason, but I don't know. So, it's almost like, do we want to maybe, again, not to criticize, but if we start with trying to survey what kind of foods the pantries are offering, to see even if this is going to be something that would be able to be implemented in most of them. I don't know, or something, because, sometimes it's like you get what you get and you don't, and until we have a way of helping them get better types of nutrition dense food. So I don't know, just looking at it one step back. So.
No, that's very true. We were also looking at it also on a procurement policy. So for example, like we know there's some food pantries, we never want to say that they would turn down any type of donation, but maybe if there could be some type of guidance that we could provide them, that in the donation policy, that it does ask whoever the donor is, if they do have, because a lot of what we've seen with other food pantries is they don't even have language in there that asking the donor for healthier foods. Not saying that they would turn down foods that are not healthy. Obviously, we want to accept any type of food, but there could be like, hey, if you do have a more healthier option, could that be the first tier that you give us versus another option? Just giving that knowledge, or just giving them the opportunity to give that donor like, hey, and the donor could be like, oh, absolutely, we do have that. Because sometimes we've noticed that they may not even know that the donor may not even know that the food pantry may even want that as an option. So just having that conversation, or just opening that up, and as far as like when we're talking about like a donor policy, so even that could maybe provide them maybe several other options that they didn't even know were available to them.
Yeah, no, I agree, Jessica, because it's because sometimes people will just, like you said, they'll donate what they like and they may not have healthy. So yeah, I think that would be a great opportunity to have a guide to like, this is what we would love or prefer, or however we want to say it, but we'll welcome all donations, but we really would prefer to offer our consumers these healthy options. And so they may learn too, the people that are donating the food may learn too.
Exactly. Yep. Perfect.
That's great. I think there's definitely an opportunity for us to serve as almost the advisory team to promote this kind of change in their policies. So excellent discussion. Anyone else have any feedback around strategy 5? All right. Strategy 6. I see we have Anthony on, but this is around expansion of the Healthy Minds, Healthy Bodies grant. Anthony, do you want to speak to this grant a little bit?
So the Healthy Minds, Healthy Bodies program is specifically targeted for veterans that have a partial disability. We provide 16 sessions with a certified physical therapist, and the participant, along with a companion, are provided with a 1-year pass to our facilities. And so it's part of it is, and then also as part of this program, we offer monthly social events. And the overall goal is to assist veterans with reintegration into society, help to, when it was originally developed, it was focused on those veterans who had served in the Iran-Iraq conflicts, and then later was expanded to veterans from all wars. And so, again, it's one of the things that we were dealing with is a lot of veterans who were having anxiety, social integration issues, and we felt this was a good way to get them out, engaged, and then also provide an opportunity for them to interact with other veterans off base, so that they have a different opportunity. Within Prince George's County, I think we have over 60,000 veterans. So we felt this is an important program for us. So just wanted to, I don't know if you have any additional questions on that. With regard
What
to the
is
funding,
the
originally,
current enrollment? Oh, go ahead.
current enrollment, I'd have to verify, but I think we probably have over 100 veterans that are currently active. When we opened up the Southern Area Aquatics and Recreation Complex in Brandywine, we did get an influx of additional applicants. Especially after COVID, we had a stack of applications that needed to get processed. So, some of them, especially the Vietnam veterans, they're already eligible for our senior ID, which is free for Prince George's County residents, 60 and better. But I think the additional opportunity to get the PT was also a great opportunity for them. And then, that 1 year, obviously we want to try to get them engaged. And then hopefully once they come out and see what a great program or great facility, that they'll continue to participate on their own.
Excellent. So thinking of just how we can integrate this into our work plan, I put as step one to identify a focus population. So are your thoughts that this would remain entirely based on like a veterans program?
This one, one of the other along similar lines that we were looking at with just before COVID hit was a similar program for those in the cardiac program at Doctors Hospital. We had a community center just about across the street on Good Luck Road, and we felt like it would be great to have referrals from the cardiac unit, have patients come over, offer them the same thing, especially those under 60, an opportunity to get a year's pass to the community center fitness room, and then offer the physical therapy and or just orientation with regard to how to use the equipment, and then provide other opportunities for social events, as well as just market our other existing programs. And then, unfortunately, once COVID started, that kind of dropped off, and we have not circled back on that.
Anthony, that's what I was also just thinking. I think we have talked about this before. It's, like we have a large DPP initiative from HSCRC at the state level for, national diabetes prevention, as well as the diabetes self-management programs. And, healthy lifestyles include that fitness component. So I'd love to maybe talk to you about how do we, because this is a great program that you're talking about for the veterans, but I think it could be something, and it would be a great incentive for people that it's a year-long program. So we need a lot of collaboration, and we've been talking about, I know what we're doing is within the infrastructure of the hospitals and their geographic region, building these community coordination care events and linking all the resources in an area that would benefit, and we could strengthen each other. So, like you're saying, if there's a community center, we could offer for these chronic diseases, especially with diabetes or pre-diabetes, it would sort of hit on the obesity side as well. But I'd love to maybe see how we could help. We have an HSCRC grant, and would love to maybe brainstorm and see how we might be able to do that for that targeted group.
Yeah, I'd definitely be open to it. I don't oversee the community centers, but I do oversee the senior centers and then our health and wellness unit. So, but we all work for the same agency, and I know that they've expressed support in the past, and it's part of our overall strategic mission. This would definitely be something that we would love to collaborate on. We have a lot of great resources. I'm always trying to market them, the residents of Prince George's County, and sometimes it's part of it is just not being aware or not feeling comfortable. So what we do with a lot of our programs is try to create a welcoming atmosphere, and so people feel at ease and are welcomed into the programming and feel empowered to go ahead and take advantage of everything that we have to offer.
Yeah, thank you for that, Anthony. And I think the really nice thing about a DPP program is it is like a weekly program that includes a group of people. So, sometimes it's just connecting the dots for them. Like, oh, we'll talk about exercise this week. Well, did you know as part of this program, you can ...
Yeah.
and guess what? It's right across the street. So, I would love to maybe strategically figure out like where are those community centers, where are our DPPs, where are our hospitals, where are providers, and then see how we can even pilot like one of them and see what we can do. I'd love to do that with you.
Yeah, definitely. We're definitely open to it.
Okay, I'll send you something to try to set up a meeting.
Excellent. Thank you both. And one other population that came to my mind is just thinking of the community health assessment. We saw that screening rates for cancer are high, but treatment rates are low. So I don't know if this could be just another way to engage people in activities and find out just how to reach them. It's kind of a far reach, but just, figuring out what those barriers might be to treatment. I don't know if this is the right way, but I don't know. It sounds like we have a couple different populations that could be immediately addressed here. So I think this is great. Thanks, Anthony, for bringing this up to the group.
And I mean, we're always looking for ways to cross market, whether internally our programs and amenities. We have a lot of festivals, and then at the festivals we partner with a lot of outside organizations. But then we also use that as an opportunity to share information regarding our own programs.
Excellent. Thank you. And Margaret, if you and Anthony can keep me in the loop of whatever next steps you all think about, let me know.
Definitely. Thank you, Kim.
All right. And finally, strategy 7 is focused on monitoring and promoting policies that increase access or address barriers to active living. I used the FIT Act, which I'll go over a little bit more in just a second, but the idea behind this strategy is just using us as a coalition to stay on top of and aware of any policies that are coming out at the state, the federal, or the local level, so that we can, and my side, advocacy is not the right word, but we can kind of share the information and allow people to make decisions or advocate for those policies. So internally, that would involve just doing a little bit more monitoring of federal, state, and local policies that are relevant to this group, providing updates at the monthly meetings, and then using our partner communication channels to raise public awareness around the utilization of these resources. Finally, monitoring the implementation and then providing any recommendations before they're approved to the Board of Health or County Council to improve or focus policy implementation on high risk or areas that need. So any thoughts around policy monitoring? All right. And just to give a quick overview, speaking of policies, the FIT Act, this is a federal policy that's under has not yet passed, but this act is the Personal Health and Investment Today Act, and it allows the use of pre-tax dollars from either a savings account, a health savings account, or family savings account to pay for health club memberships, fitness equipment, exercise videos, and youth sports leagues. So it would be a tax deduction of up to $1,000 for individual or $2,000 for a joint head of household for qualifying sports and fitness expenses per year. So it could be a gym membership, an activity program, it could be a youth sports event, or just equipment that keep at your house. So I thought this was really interesting, and I definitely want to stay on top of it because I feel like it could be something good for us to just promote so people are aware.
Kim, I would just also part of that act, I think it would be, right now there's a limit on the FSA that you can, for families. So, it would be great if you could also increase it, because then you're taking away money from the co-pays for and prescriptions and, covered services that give direct care. So, for medical, I think there's qualifying expenses, but it would be also a win-win if we could look at seeing if we can increase the allowance as well.
That's a great point, because you don't, if you're already using your $5,000 on childcare, would that then mean that you can't use it somewhere else for the FSA? But
yeah, I'm just, you can look at, for those that don't have a lot of medical, but for children, I know we blew through ours because you have, prescriptions for 3 kids, co-pays for 3 kids, that can go like that.
mm-hmm. That's a great point. Any other feedback around this one? All right, moving in. And so I know Patrick Callahan is not on today. He's our healthy food priority areas lead. However, we are definitely going to continue with our efforts around promoting HEAL and county policy and zoning. Patrick is currently working on updating all of the maps. I think he has a list of all the facilities, the food distribution facilities in the county. One thing that we've really been struggling with is this designation of a healthy versus unhealthy for restaurants. It's a pretty big lift to go through this level of, people's changing menus, or just the variety of foods that a restaurant might have. So in the previous healthy food priority areas map, restaurants were left off. So I think we'll kind of come to a point where we have to make a decision as to whether we want to try to create our own process to include restaurants, or if that's not feasible, if we just want to move forward with the updated data and follow the same process as the previous map. And on that point, we did have, there's a new county policy, CR 46, that is the healthy food program implementation policy. And they have, so the idea behind this program, and I think we've talked about this a couple meetings ago, was that there's a certain defined percent of foods that would need to be considered healthy on the menu for the restaurant to apply for this program. So it's a completely voluntary program. However, the definition of what food is healthy and what food is not healthy does not exist. And for us to take that on, we would need to find a way to define that, and then to have the resources to monitor it. So we are currently waiting for additional guidance from health department leadership on the next steps for implementation of this program. But in case anyone heard about it, I did want to mention that. I know internally, Leslie has spoken to, the complications, and I think of defining a food as healthy or unhealthy. It almost comes down to the individual levels and what their current needs are. So again, it's a pretty big lift, but I think that the FDA is coming out with new guidelines as well. It would also require a pretty high level of expertise, I think, to be able to decipher and apply that to our over 1,000 restaurants in the county. So with that, we are still defining the timeline for the implementation of this new map. I think it will be very dependent on a lot of these decisions. If anyone does have feedback or if they're aware of best practices for this kind of designation process, please reach out. We would love to hear it and engage more. And then again, once the map is produced, we'll do promotion with the Board of Health and community partners so we can really identify the need for additional grocery stores or healthy food options in those areas. And then advocate for local policies that support healthier food access, specifically in those locations. So it's great to bring any healthy food into the county, but we don't want to further any of these disparities.
Royal Farms.
Oh, Anthony, what was that?
Oh, I was just making a joke about Royal Farms.
Ah, yes. I think you can get bananas there. All right. So I know that I started moving a little bit faster in the end. I want to be mindful of everyone's time. So I do want to give an opportunity for any additional subcommittee updates. Food as Medicine team, anything from your end? Okay, and I think we kind of touched on all of the recent updates with that group. I did want to give the update that for anyone that wasn't on the last integrated health call, we have decided to sunset the integrated health subcommittee. It felt like some of the goals that group was taking on were a little more expansive than we could manage with the participation that we had. So instead, we've decided to open the community care coordination team, and that will be its own separate work group, and we'll already have the support and leadership of the previous health officer, Dr. Carter, to serve in that role. This will just be a revitalization of the previous CCCT group. We are defining any new branding, and we're hoping to get things moving to set up a first meeting in late September. So there will be more information coming out about this group. Anyone that was previously a part of it will certainly be invited, as well as the participants from Integrated Health. So be on the lookout, and we'll have news around that group, which will be primarily focused on addressing access to care. So now I'd like to open it up to any community announcements. And if we don't have any, I do want to remind everyone of these health awareness events that are coming up in the next 2 months that were relevant to this group. So August is National Breastfeeding Month, and then September we have a lot: Healthy Aging Month, National Childhood Obesity Awareness Month, National Childhood Cholesterol Education Month, Fruits and Veggies Month, Yoga Month, Women's Health and Fitness Day, and then World Heart Day. So in the event that if you have any events going on that you'd like to promote, please feel free to either add them to the calendar or send them to me, and we can make sure to get them in the coalition newsletter. Amber, I see your hand raised.
Yes, it's very early days still of the Prevention Link 2 grant, but we do have a new measure this go around to implement, spread, and sustain one of the following evidence-based, family-centered childhood obesity interventions. It is the acronym CORI, and we'll be connecting to pediatric telehealth. So definitely more on that to come, because there might be some overlap with the work group.
Okay, thank you. Yeah, I think we would definitely love if you or anybody from the Prevention Link group joins and can provide some updates around that. Will do. And then just for upcoming meetings, the next HEAL work group meeting is October 4th, and the next quarterly meeting, coalition quarterly meeting, is Tuesday, September 12th, and this one will be a virtual in the evening. All right, any last call for any other updates or announcements? Anthony.
So just reaching out to Amber, one of the programs that we do run are after school programs, after kids care. And so some of the sites are eligible to receive after school meal support from PGCPS. But we also have other sites that are not eligible that do provide snacks, after school snacks. Yeah, I'd love to see if we can collaborate, because one of the things that I had tasked our youth services unit was to work on nutrition guidelines for those programs.
Like I said, it's still really early days, so I'm not sure if we will have overlap with that itself, but definitely the more we learn about this new intervention, we'll reach out.
All right. Well, thank you all so much for joining today. And again, reach out with any updates that you have. And if not, we will talk to you all soon.
Thank you.
Thank you. Bye, everybody.
Thank you.
Thanks.